Hi, everyone. I've got a real treat for you. On this week's episode of Physio Foundations, I'm talking to specialist sports and exercise physiotherapist Randall Cooper and APA sports and exercise physiotherapist Mick Hughes from learn.physio. And we're going to talk about the foundational knowledge and skills that help them become leaders in the field of ACL injury and management. Welcome to the Physio Foundations podcast, a podcast about the knowledge and skills that provide the foundation of expert clinical practice. I'm your host, Luke Perraton, and in this episode, I'm joined by both Randall Cooper and Mick Hughes from learn.physio. And as an extra special bonus, I'm also joined by the other half of Perraton Physio, Zuzana Perraton. And I'm going to introduce Mick and Randall, and I'll introduce Zuzana properly on her episode, which is coming up soon. And then we'll break into a panel discussion with me asking some questions and everyone chipping in. So let's start with an introduction first, then I'll bring the guys on. So Randall is an internationally recognised sports physiotherapist who's worked with Olympic athletes, famous footballers, and lots of other everyday athletes and people with sports injuries. Randall is going to be really well known to a lot of you in the Musk physio world, especially as a physiotherapist for AFL football players and Winter Olympic athletes. He's the co-founder and CEO of the skincare company Premax and the physio education company Learn.physio. Randall's also a specialist sports physio as recognised by the Australian College of Physiotherapists and an adjunct senior lecturer at La Trobe University Sports and Exercise Medicine Research Centre. And he's also published lots of ACL articles in high-impact journals. So he's the triple threat, the singing, dancing and acting. And Randall's partner in crime and the other half of learn.physio is Mick Hughes. Mick's an APA titled sports and exercise physio. He's also very well known to many of you out there for his work translating research and providing clinical education via social media and his blog and YouTube channel. Mick's just relocated with his family to Townsville, far north Queensland, and he's previously worked with many athletes in the Melbourne Sports Medicine Centre and high-level sports teams and athletes. So Mick's clinical special interest is ACL injuries as well, and we'll talk about that. We're really lucky to have these guys on the podcast for a chat. I'm sure you're looking forward to hearing from them. So let's get on with it. Without further ado, Mick and Randall, welcome to Physio Foundations.
Thanks, Luke. It's a nice introduction, mate. Thanks for all the kind words. Appreciate it. Thanks for asking us to come on the show.
Yeah, thanks, Luke and Zuzana. It's great talking to you today.
Thank you for coming.
Let's go. Let's get straight into it. We've got ACLs to talk about and your work with learn.physio. But in this first episode, we're going to do part 1 and part 2 and release them weekly because there's sort of a different theme of each one. In the first part, I want to talk to you about how you got to where you are. And so the theme of this podcast is the foundational knowledge and skills that provide that base for expertise. So let's start with you, Randall. We'll go back and forward. We'll bring Zuzana into the chat as another expert. I've already given the listeners a bit of background on your qualifications and achievements and specialisation, but can you tell us a bit more about what led you to being interested in being a physio? And then from there, what led you to being interested in specialising in ACL injuries and knees and sports physio?
Well, I was unfortunate enough in year 11 to have a really rough year medically. I was skiing up at Thredbo and I decided to go and jump off a big rock. And on landing, I blew out my knee. I did an ACL and MCL, and I had no idea about knee injuries at the time, obviously being 16. But I needed a ACL reconstruction, and that was the easy bit because I then, about 2.5 months after that, acquired Guillain-Barré syndrome and spent like 2 to 3 months in the Austin hospital recovering simultaneously from an ACL reco and also Guillain-Barré syndrome as well. And up until that point, I had no idea what I wanted to do. I toyed with the idea of becoming a chef. I toyed with the idea of becoming a pilot. But my world was just opened up to medicine and exercise and physiotherapy. And the way that those health professionals and exercise scientists impacted me was profound. And I don't use that word often, but it was a massive turning point in my life. And I thought that if I can do that for someone else and I can have an impact on them like they had an impact on me, what a great career. So was one of those students at school who was just happy to kind of get through on some level of base ability. Always could apply himself more was the bottom of every single school report card. But once I kind of had these medical issues when I was 16, it just changed, and I kind of got my act into gear, and I wanted to go and do physio, and I got into physiotherapy and just loved the degree. And then from that point on, that's where I thought, sport and sports medicine is where I want to head. So that's the background to me being a physio.
There's a real personal story there, isn't there, where you've seen the positive effect that really high quality care can bring. I wasn't expecting that. That's quite a story.
Do you want to just? Sorry, I was going to say, do you want to just explain what Guillain-Barré is, just generally?
Yeah. So it's an it's neurological autoimmune disease. They don't know why people acquire it, but essentially what happens is that the body undergoes some level of immune trauma. So it's usually you just get a bad cold or virus or something like that. And then for some reason, the immune system then switches around, and rather actually attacking the virus, it attacks the myelin sheaths around your nerves, and it demyelinates your peripheral nervous system over time. And I went from being a pretty healthy kind of 16-year-old boy who was recovering from an ACL to intensive care in 7 days. And it's very much like MS, but a lot worse. I couldn't move. It's essentially like you get paresthesia and anesthesia. You also kind of lose coordination and also strength in your limbs. And if it gets bad enough, it also can affect the muscles of respiration. So people who are kind of bad enough will actually need to be respirated in hospital. I didn't quite get there. I was close. But like I was weak, but so weak that I couldn't turn in bed, and I had trouble shutting my eyelids to go to sleep. So that's how weak I got with Guillain-Barré syndrome. And, my parents were freaked out. But for me, and it was obviously a low point kind of in my life right at that time. But as I started to get better, and as I started to kind of learn more about the body and medicine and exercise, the more it just stimulated my want and need to kind of get into this area. And here I am, like 30 years later, still doing it.
What a story. Thanks for sharing that, Randall. What about you, Mick? How did you get interested in being a physio? Because you're formerly an exercise physiologist. You bring those knowledge and skills into your physio and then into a specialty in ACLs.
Yeah, I think I certainly don't have the wonderful story, heartbreaking story that Randall has, and the fight for survival and the return to the best. But I certainly, I think like most physios, I think I heard this, familiar story that we were, athletes that never quite made it, had played multiple sports throughout their, junior schooling and high schooling, and sustained a few injuries along the way, and found themselves on a physio table numerous times. And I've, like having that same story with me, multiple, ankle sprains. Never had anything serious, to be honest. I've actually never torn my ACL despite my strong interest in it. I've ruptured my PCL playing basketball, which still sort of is quite loose to this very day, 22 years later. But that was those moments there growing up and seeing the inside of a physiotherapist clinic and seeing the wonderful things that they were doing kind of like really resonated strongly with me. And being, once again, similar to Randall in that I always could have tried harder in both primary school and high school. I never got those grades that made me or enabled me to go straight into physiotherapy school from high school. So that's where the exercise science came along. I was really interested, obviously, in sport, and PE did well in those subjects growing up. And then, those combinations of, playing lots of sport, exercise science degree, and knowing that I had probably a little bit more to offer. Not that exercise professionals and exercise physiology is not a bad career choice. I just always felt this burning desire to be a physio. But I always knew that exercise science was always going to lay a great foundation for my physiotherapy career in the future too. I felt even from an early age, those two skill sets combined could make for a very good physio. So that's kind of, how it started for me, from a lot of ankle sprains as a young basketballer, if we take it all back. But that's my little story.
Good on you, Mick. Thanks for that. And so students in particular listening to this, see, it's not all about the grades. There's an important story there, and something's got to get you out of bed in the morning and motivate you to do all the work that you need to do across your career.
Yeah. And I'll add that. Sorry, Luke. I'll just add to that too. Just once again, I think even for those physio students that are there, I was also a pretty rubbish first and second year physio student. I didn't really come home strong until third and fourth year after my clinical placements, and actually got to treat patients and be in a clinical setting and that kind of stuff. So, and then master's placements as well in the future, upon graduation too. So even if you feel like you might not be doing that great in the grades, some people, just being in that clinical environment really sings to them, and being out there touching patients, having involvement on a day-to-day setting is probably the thing that really sparks a desire to learn and get better as physios too. So you might even be a late bloomer like myself who probably didn't really hit their straps till they were 40.
I agree with that. I had a friend on a clinical placement, and I was struggling because I had, the top students with me, and they knew all the knowledge, that they'd memorised the textbook and I hadn't. And so I was really stressed out. And then my friend just said, look, Zuzana, don't worry about them. Just learn from your patient. Whoever you get put in front of you, learn from them. And it then made that relationship with the knowledge and using it that then stuck into my mind, and that's when I started really enjoying it. Just like you, like once you get to that patient and actually seeing how to apply what you've learned, it just really makes it. It really makes it.
Yep.
So, especially if you're a student in the first and second year of your course, it's a long game. So keep going. That's some really good points. Guys, what about being a sports physio? So all three of you are sports physios. And so what does a sports physio do? Who are some of the people you work with? What do you do? What do you love about it? Perhaps to Randall first.
The sports physiotherapists can do a lot of things. I don't think there's actually kind of one model, and it's changed enormously over the last 10 or 15 years. For me, I felt that I was extremely lucky because I personally was able to work in elite sport, and I also worked with athletes of all levels kind of in the clinic. So Zuzana and I know each other from the Olympic Park Sports Medicine Centre in Melbourne, and in that setting I would have everyone from 10-year-old young netballers who have sprained their ankles all the way through to Olympic athletes. I generally, most of my clinical life, I did about half and half. So I spent about half my time in the clinic and about half my time working with elite sports teams. So the clinical work, most people would be quite familiar with that. Most physios will see patients every half an hour, three-quarters of an hour if you're being generous with your time. You'll work with that person to help them achieve their physical goals and get over their injuries and their problems. And then in the elite sports setting, I was fortunate enough to work with AFL team. I worked with Hawthorn for about 6-7 years, also with the Winter Olympic Australian team. And again, the role there was quite different. So with the football, for instance, I would be there for treatment sessions at the football club, would be there for training sessions before and after to get the players prepped and also recovered after the sessions, and then obviously be there on game day as well. But my work with like the Olympic winter team was very different, where I'd actually travel and I'd be on the road for sometimes up to 6 weeks. I'd be 6 weeks away from home. And it was kind of nice in some ways because with football, you've got 44 athletes to look after. When I was traveling with the skiers, like I usually had 4. So there was a little bit of time to kind of do some extra study, think about other opportunities and ventures, but also when you're traveling around the world is actually go and see some different places and sites and whatnot as well. So it can be quite varied. That's just my experience. So I know, Mick, you've had, slightly different, so I might throw across to you, mate. And
just echoing what Randall said with the roles and responsibilities of a physio. My sports physio experience was quite varied in my early stages. So I worked as a new grad. And this is before my titling. So often that sports physiotherapist often has to do probably at least a minimum of 5 years of sports experience, but also then clinical experience to then sort of into the postgraduate courses and that kind of stuff. But I cut my teeth in rugby league here in Townsville as a new grad, and then moved to Newcastle, where I was involved in an elite junior soccer program with Newcastle, and then we relocated to Melbourne, where I was involved, and got my first, I guess, full-time head physio gig with the Collingwood Magpies netball team in their first year in a competition. And so, that was my journey, and I think my experience with the netball, and probably netball was probably my first real taste of what it actually is, what Randall described. You're there day in, day out. You're at training sessions. You're actively involved in triaging acute injuries that may happen at training and/or games. You're there through the week to give treatment sessions to those that need it. You're there monitoring the gym sessions. You're testing. You're assessing players' readiness to train and play. But also to having regular in-depth conversations with the club doctor, strength conditioning coaches, assistant coaches, high performance managers. Like, it's just quite a complex environment to be in, especially in that elite world. And in netball at that time, it was pretty lowly staffed in a way that I was the only physiotherapist with the club, with a group of 10 to 15 players. One strength and conditioning coach, one doctor. And AFL land, we might have up to 4 physios working for a club in varying capacities, 2 full-timers, 2 part-timers. Another coach still have a varying amount of medical staff, exercise professionals, sports scientists, head coaches, assistant coaches, all that kind of stuff. So it was nice to be involved in netball, because it was kind of like just a one-way command. It was only a small group of individuals to make these decisions for the athlete, or help athletes make those decisions on playing availability and training. So I had a great experience. And to be honest, I guess another thing I wanted to bring up was that, I always thought, going through my sports physio training, is like, if you're going to all this effort to become a sports physiotherapist, wouldn't you want to work in sport for forever and ever? And after being involved in sport for a year, I'm actually quite happy not to go back to the professional sporting environment as well, and just consult and do what I've basically done for the last couple of years in Melbourne, and what Randall did there for a while. Is you've got a really meaningful role to give to both semi-professional, professional, sub-elite athletes. As a sports physiotherapist in a clinical setting, you don't have to go to training sessions, night in, night out, lose your weekends with traveling and all that kind of stuff, as much as that can be really cool and fun for a while. I think when you get a bit older and you start having kids and family, and you start to prioritise how important family life is, you happily let those training sessions go to someone who maybe have a bit more time and freedom, and you can take a back seat and still have the fun stuff and still consult in the sports physio way. But do it in a clinic rather than that team environment. So, that's my little bits of wisdom there, if anyone wants to take them on board.
That's brilliant. Well, you both answered one of our questions, which was, how does your work differ, in a elite sports environment versus, in a clinic with non-elite athletes? Do you have anything else that, Randall, perhaps to add to that question, or?
Well, can I have a?
Oh, please,
I'll
Zuzana.
have a go.
Zuzana's here.
I'm very similar to Randall in that I've travelled with the Winter Paralympic team, and I've done 10 years in footy, and ended up in an AFL club as well. So what I really love about working with elite athletes, or just with the team, is how the relationships you gain with the players. It really you become friends. And the other thing that is really nice, so you look forward to going to work, is the injuries. There's so many, but you see all parts of the injury, and you're in charge of the injuries, in terms of a lot of times you might be able to see the actual injury happen, and you're able to assess it there and then, which you can't do in a clinic. So when you're in a clinic, you're really relying on what they're telling you has happened, whereas particularly sort of in the AFL, they can replay it. They'll have a tablet there on the sideline, and they can replay it from video footage straight away. Which way did the knee go? Which way did the ankle go when they fell? That sort of thing. So that's really quite exciting. The other thing, and this is where Randall and Mick really instrumental in setting up, your ACL assessments and programs and rehab, is that experience of when you are looking after a team, it's up to you to do the rehab. And if they fail the rehab, then you have to look at what you did. Because in a clinic, if someone, say they've had a hamstring strain and they come to you and you've treated them, you've gone, say, 6 weeks, intensive rehab, they've returned to sport and they've restrained it, they're not necessarily going to come back to you, and you don't necessarily know that outcome. You just may assume that they've, gone successfully, because it might be the second or third game in that they restrain. So you might follow up and say, how'd you go? And then, yeah, it was fine after the first game. And then they might go see someone else. But when you're working with a team, it's really up to you, and it's that reflection of looking back at what you did with that player that you really, really learn. I mean, what do you think about that, Mick and Randall?
I might chime in with that one, because I think that you make a really excellent point, Zuzana, and that is that you're totally accountable when you're in that elite sports environment. You have to do the rehab, and if it doesn't go all that well, there's nowhere to hide. But a lot of clinicians who only work in private practice, they get a godlike kind of thought about themselves, because all they experience is people getting better. And the ones who aren't getting better and dissatisfied just don't come back. They don't write bad letters, or they don't complain on Facebook, very, very rarely anyway. So some practitioners get this godlike complex that they think that they cure everyone and all the time, and it's a bit unhealthy at times. Whereas when you're working with sports people in the team, and you've got to be there from start to finish, and also 3 months after it too, you know whether you're doing a good job or not. And if you're not, you'll find out about it really quickly.
Yep.
And
yep.
the other
thing,
go me.
Oh yeah, no, I was just going to echo those kind of things, and like to be honest, it does make you accountable. And I lost a couple of sleepless nights, dwelling over the injury data on a player that we had in our club who sustained a second ACL injury, in our club, and it's you do it just when you're the person that is accountable for these athletes, it does make you reflect and go back and look for could you do things better, which I think is really positive. And if you you might take it, some of the injuries to heart early on in your sports career, but ultimately it's a learning experience, and it's probably one of the best learning experiences you'll get throughout your physio career.
Exactly, and I think your previous guest that you had on here, Luke, was saying, you don't look at it and think of it as you failed. You look at it and say, okay, what could I have done better, or what could have changed? Because it might not even be you that's done it. I know countless physios who have handballed, the strength and conditioning to someone else, and hadn't had that smooth transition from rehab to strength and conditioning, and then the athlete has re-injured. And so then, really looking at sort of the processes behind there, what were the outcomes, what were the aims, etc. What needed to happen and what didn't happen. So it's really good in terms of, I think the other thing that sports physiotherapy you get a lot out of compared to some of the other, like if you're just like in private practice, like you're talking about, Randall, is that sports medicine team. And you touched on that, Mick, as well, that it's really working with other professionals and really being, interdisciplinary. If you travel with a small team, like you said, Randall, you might just have 4 athletes. You end up being a dog's body. You're not just a physio. You might end up having to be the massage therapist. You might have to be, the strength and conditioning coach. You might have to be the person that takes all the equipment up onto the snow, all of that. You might be, I remember freezing my hand doing the videoing up in Vale, and every time, because the fingers to focus in and out had to be out of the glove, and you just had this frozen hand. But I wouldn't have it any other way, travelling with sporting teams. It's a completely different experience to clinic, and I think that's what's exciting about sports physiotherapy is all those different things, that learning from others. I know that Randall and Mick, just working in a team, I don't know about you, but I learned so much from other professionals, particularly doctors, being able to come up with the scans there and there and looking at them and talking about them, and having everyone's perspective and, prognosis discussions there and then, with multiple. Because I think in a clinic, that's one thing that we probably don't get a lot of, is that, talking about who you've just seen, what you've just seen in your plan. I mean, you do that obviously with the patient or the athlete, but you don't necessarily get feedback from other professionals.
Speaking with three highly experienced sports physios, and then I'm loving it. Really, what we talked about so far has really been the experience, your personal experiences, and reflections on what you're doing. Let's finish off this part one with a little bit of a list, perhaps for clinicians, practitioners of all levels, students, new grads, anyone. If you were starting again, if you were building yourself back up or building yourself up towards expertise, let's talk about the most important knowledge and skills the sports physio needs to have. And it's nice that we've framed it already with quite a broad discussion. And what you've just said, it's not going to be just physical examination skills, but we can talk as broadly as we like. What about you first, Randall? What knowledge and skills do you really need every day to do a good job as a sports physio?
Luke, this is a really hard question because, as I'm sure everyone will nod their head when they say this, I mean, experience counts for so much, and you need to know a lot, and it's not only kind of the anatomy and physiology and applied biomechanics and all those things that we learn in university. And I think following on from, Zuzana's comment about before about, some of these softer skills and learning from others. I mean, sometimes you're dealing with quite intense situations, like you do have someone who, you work with a sports team, they redo their hamstring, for instance, and they're devastated about it. Like you've got to have almost like a psychologist's hat on to be able to kind of deal with that situation, rather than just being a clinician going, oh yeah, you've had another grade 2 hamstring in, a biceps femoris, and it's going to be a 6-week injury. It's like, no, you need to treat them as a human. So I think that, as far as the skills, and I don't say this lightly, and this is a considered comment, by the way, is I think that some of the most successful practitioners that I've ever been around in my life are the ones who communicate the best and get on with people well and can articulate their message really well. They clearly know their stuff, but you've got to have both. You've got to understand the science. You've got to be good with people. So they're the two skill sets that people really need to build.
Yeah.
What do you think, Nick?
I echo those completely. Yeah. The foundations that you learn at university, the way your understanding of anatomy, physiology, biomechanics, absolutely, it all helps. But it's those soft skills, so to speak. Soft skills are actually quite hard, like to be empathetic, to communicate well, to act as that psychologist and to be that sounding board to people. Like it actually is a lot harder than what it seems sometimes, and it's not for everyone. Some people just don't have that ingrained personality to be empathetic or like to sit and listen and look. But that'll be the difference between someone who's an outstanding sports physiotherapist who will have a long career in the game compared to someone who maybe textbook savvy and textbook smart and know all the tech and you can be able to sort of use assessment pieces like force plates and jump data and all that kind of stuff. They might be able to analyze the crap out of that. But if they can't have a conversation with someone and relay that information in a way that both the athlete and the coach understands it, that they might not find their career last that long in the sports physio world. So, but definitely, but that comes with time, right? And I think I've become, and sometimes it just comes with your own personal experience. Like I've become a much, I think, better clinician after having kids. Just having young kids to negotiate with every day. Like just to talk to, communicate with, that level of patience that you gain from being a parent. Like those kind of things, and some of the things that get thrown your way on a daily basis sort of comes with just what happens, as you get older and you might have family and that kind of stuff. So. These are the things that happen with time, and I think as a sports physiotherapist, even when you're sort of 5 years out, and you might be halfway through your postgrad sports cert, or you might have just started, your masters of sports physio. You might be sort of, really, chomping at the bit to get out there, and you think you might be the best, sports physio that's going to have a long career, and ultimately it's probably going to be those next 5 or 10 years that really, sharpen you up and make you see you're going to, be one of the best, or are you happy just to sort of sit back and go on with life in a different way? Look, I definitely, to sum it all up, I think absolutely those soft skills and those communication skills are a big difference between a good sports physio and a bloody excellent one.
That's such a good segue, because my last episode was on communication and explaining things to people in a clinical environment. And then it was Brian Kim, who Zuzana mentioned, who's a grad of Monash Physio, who was talking about the importance. When I asked him the same question, and I, follow-up questions, I was thinking he was going to talk about his anatomy and physiology and assessments. He was focusing on the person as well. So, Zuzana, you've come back from work many times and told me similar stories about how you've been successful really through interacting with people and coaches, and more than just impairments and things you've measured. Do you have anything to add to that, what the guys have said?
I think the other thing that's blaringly obvious that we've admitted is, as a sports physio, the mental health side of it. So Mick, you've said, sitting down and listening to them, because sometimes it's, that mental health of continuing, that's where they get this, with sport, the social, all of that sort of stuff. That's where, they're quite happy. And when they get injured, it's really quite tough. And, I've seen many patients that say they love running and that's what they do. They get out of they get into their zone, away from the kids, all of that, and that's their happy place. And then they have an injury and they go see someone and that person says, no, you can't run. You've got to stop running. And I think that's where a sports physio, and that's why you go and do another degree, you got to go do your masters, is really understanding, the intricacies of sport and the different sports. So what is it that they need, et cetera, and being able to tailor make, your management to their sport. So how do you modify it? Because from my point of view, I find people improve if you can keep them in sport or keep them in, active, rather than taking them completely out and saying, okay, we just got to let this heal and let's just do some passive work here. I find even if they can't run, a lot of times they can walk, they can still have that headspace, and they can do little drills, etc. But yeah, it's really acknowledging the sports and what is essential for that particular sport, which is going to be different from football, different from skiing, different from netball, different from rugby. And like you said, Mick, Randall, to be a good sports physio, you've got to sort of understand the sport that you're in as well.
Guys, we're near the end of part 2, but near the end of part 1. You wish you were at the end of part 2. The Winter Olympics are on. 2022 Winter Olympics are on right now. Randall, you've worked with Winter Olympic athletes in the past. Favourite Winter Olympic moments? Do you have any?
Oh, I've got plenty. I mean, obviously there's some that are personal, and I was fortunate enough to go to the 2006 Winter Olympics in Turin, and the lead up to that was just a massive roller coaster, because we had 2 of our medal prospects, Elisa Camplin and Lydia Lasilla, both do their ACLs within 7 months of going and competing at the Games. So we had to do an accelerated rehab program for both of them. And they were both looking great leading into the Games. And then I suppose this is just sport. Sport's the story that writes itself, and it's full of drama, and we're seeing that right at the moment. But Elisa walked away with a bronze medal when she thought she wouldn't even podium, and Lydia redid her knee, going in the best jumper of that tournament at that point, and needed another ACL reconstruction. So I suppose that's kind of going back to what we were talking about before about being accountable. That was a bittersweet Games for me. But I suppose, and Zuzana, I'm sure you'll probably agree with me. It's once you've kind of been involved in a sport, such as for me, like winter sport in Australia, you can't not really kind of continue to follow on anyway now. So just even watching these games in Beijing at the moment, it's just terrific to see how successful the Aussies have been. Even some of them are competing there at the moment. I've helped with their rehab to kind of get them to these games as well. So that's extremely satisfying to watch as well. So, but it's not all about me. It's just nice to kind of watch sport, particularly after the last couple of years with some crowds and being able to compete for real medals.
What about you, Mick? There's must be a lot of chatter on the streets of Townsville about Winter Olympics. There's a hot place. Oh, maybe there is. What's your favourite moments?
Funnily enough, we've been tuning into some of them, but one of the funniest stories that came out, I didn't know this guy, there's a luge character, his name's Alex. Randall might remember his name, but the last name escapes me, but he's actually a Townsville boy. He competed, I think he finished maybe 10th in the luge just recently in these games. And the backstory to him is that as a teenager, so in Townsville, there's this big hill, big winding hill, big lookout point. There's one close in town called Castle Hill, but there's one at the back of town, which is a bit bigger, more steeper, called Mount Stewart. So apparently as a young teenager, he'd get down on these long, like a big long skateboard, and basically just hurl down Mount Stewart at a rate of knots for his training. And his mum would be down at the bottom of the hill blocking traffic so they didn't smash into him on the way down. So
thanks, Mum.
I thought that Alex Palazzo, thanks, Randall. So sorry, Alex, if you're listening to this podcast. But if so Alex used just to stream down the hill. That was it was an awesome story that came out of that. But look, I'm a lover of all sports, and I've been tuning into the Winter Olympics most nights, and I just it's just a unique event, like especially the evolution of some of the skiing sports, and how basically it's just X Games on the snow, and I've just really enjoyed watching some of those events, but yeah, Townsville's a funny place too. It's rugby league or die up here. So the current chatter around town is the upcoming NRL season and the Cowboys' quest for another championship. So if you need me, I'll be watching footy games after footy games after footy games.
Well, shout out to Alex. I stand corrected. What about us? I love the moguls. Zuzana?
I just love anything with jumps and skis, to be honest. I mean, I like the snowboards too, like the half pipe. But just there's a certain element when you see all those tricks on skis that just, brings joy to me.
Oh, yeah. It's a fun time. Yeah. Well, why don't we leave part one there? We've had a really, really in-depth chat. We went in more depth into the professional development, the pathway, and the reflection on what it's actually like to be a sports physio. I didn't know where it would go, and I'm really happy that we went in that direction, and we got to access your expertise and your stories. So thanks very much to Mick, Randall, and Zuzana for your input here on Physio Foundations. We're going to continue and talk about ACLs and learn.physio in the next chat, so stick around for next week. Make sure you subscribe and like and share and do all those things that we want you to do. But until next time, thanks very much, Mick, and thanks, Randall and Zuzana.
Welcome. Thanks very much.
Thanks, Steve.